probably been covered, or maybe partly it was taught to you, but this topic is very important, not only from your examination point of view, but during your day-to-day practice life. The topic is the rabies, one of the most important topic, that is rabies. In the previous semester examination, one question was given to you, classify the various categories of wound due to bite of animal, and accordingly you manage the post-exposure cases. Almost 80% students could not answer properly. That's why I think this topic is not only important for examination purpose, but it is also very important during your day-to-day practice life. Why I am saying so? Because you know that rabies is almost 100% fatal. Once a person is infected with the rabies virus, it is not possible to recover. However, modern treatment facilities you provide him or her. Till date, it has been recorded that only 3% survived following rabies. So, it is almost 100% fatal disease. That's why what we can do, we can take precautionary measures by means of vaccination. Only thing is that we have to take vaccination, and all the vaccines are to be administered on scheduled date, and cold chain of the vaccine must be maintained properly, and also the person who is giving the vaccine must strictly adhere to the route he or she is following. Suppose you are following the IM schedule, don't switch over to intradermal schedule. Or if you are following the intradermal schedule, you strictly adhere to intradermal schedule. And you make sure that your vaccine was administered truly in the intradermal space. Don't give subcutaneous. So that's why for intradermal schedule, a trained person who is properly trained enough to give intradermal injection should give the vaccine. Otherwise, if it becomes subcutaneous, then there is chance of vaccine failure. So, vaccine failure may occur not only due to the failure in the cold chain, but also due to failure of vaccination at the time of administration. That means, if the proper route is not followed, if the proper dose is not given, if you give insufficient dose, how? Suppose you have prepared the vaccine by means of diluent and you have set the vial, and ultimately bubbles will appear, and when you will draw the vaccine, you will not be able to draw the sufficient amount of vaccine due to the presence of bubbles. You cannot make the vaccine, you cannot make the bubbles free. That's why don't shake. You pour the diluent within the ampoule or the vial and you just rub it like this. Don't shake it. So, proper dose, proper route is equally important, and also the person must complete the full dose. আমি 3টে ডোজ নিলাম, একটা বা দুটো ডোজ মিস করলাম, not that. বা আমি যে ডেটে আসার কথা 2 দিন পরে এলাম, চলবে না। সুতরাং you must strictly adhere to the proper dose. So, what is the term rabies? The term rabies, these rabies came from the word rabas, the Sanskrit word rabas. Rabas means to do violence. So, it is a highly infectious viral disease and it infects the nervous system. spinal cord and the brain. It affects the spinal cord and brain. And it is clinically characterized by few days of prodromal stage, that means mild malaise, tingling sensation at the site of bite, followed by sensory manifestation, that means aerophobia, fear of air, fear of wind, fear of light, hydrophobia. Then there is features of muscle spasm, that means motor involvement. Firstly, prodromal stage, then sensory stage, sensory involvement, that means aerophobia, hydrophobia, fear of light, fear of sound, and after that there is motor manifestations, that means there is violent muscle spasm. Patient is thirsty, but he or she is not able to drink due to violent spasm. Even on seeing the water, violent spasm appears. Very painful and pathetic condition. And ultimately, there is involvement of the nerves and patient fears. Throughout the illness, patient remains conscious and ultimately there is excitement, anger, frustration, and finally there is depression and patient may die of respiratory paralysis or die of coma. So, within a span of 7 to 10 days, patient will die. Nobody will be able to recover if he or she is infected with the rabies virus. If we consider about the distribution, it is distributed in almost 150 countries. Rabies cases are present in almost 150 countries. In India, every year about 20,000 to 30,000 people die, but it is the official figure, but actual figure is 2 or 3 times higher. And Asia and Africa, total number of cases who die every year about 55,000, and it is distributed in almost all countries. Few countries are rabies free. In India, within India, Nicobar Island, Andaman, these are rabies free because of presence of natural barrier, that is water. Japan is also free of rabies. Even Australia is also free of rabies. But in most of the countries, rabies cases are reported off and on. So, India is an endemic, rabies endemic country, and it is basically a zoonotic disease. Basically, it is the enzootic, that is, it is present among the animals. It is present among the animals, and all carnivorous animals are susceptible. All carnivorous animals are susceptible. So, from wild animals, it comes to the urban area. That means the dogs, mongoose, and also the cattle, they are affected. And when a rabid dog, mainly it is transmitted by the bite of a rabid dog. In 90% cases, it is due to bite of a rabid dog. So, from the rabid dog, if a person is accidentally bitten, then the person will develop rabies. And rabies is not transmitted from man to man. Rabies is not transmitted from man to man, so it is a dead end host. But the saliva of a rabid person or the tears or the sweats is also infective, but chance is very minimal. Another important transmission is the organ transplantation. Organ transplantation. Suppose a person died of rabies and he donated his body and cornea, grafting was done with the help of cornea of that dead person, and in that case there is chance of transmission of rabies to the person who was grafted with the cornea. Or if there is kidney transplantation or if there is liver transplantation, there is chance of transmission. But these chances are very rare, but mostly transmission occurs due to bite of a rabid animal or by the scratch done by the rabid animal. It is the most common mode of transmission. It is not transmitted by means of blood. Now, if we consider about the pathology, initially the virus multiplies at the site of bite in the connective tissue or in the muscles, and after that it affects the peripheral nerves and it goes along the peripheral nerves. It travels along the peripheral nerves towards the center, from periphery to center. Three millimeter per hour. It travels slowly, 3 millimeter per hour from periphery to center, and it enters the posterior horn cells of the spinal cord. It affects the posterior horn cells of the spinal cord, so there is myelitis, and after that it affects the CNS, central nervous system. So initially the direction is centripetal. After affecting the central nervous system, then the virus travels centrifugally. It spreads centrifugally and ultimately it affects the various organs, even the heart, kidney, cornea, salivary glands, and when the virus comes in salivary gland, at the time of biting, the virus enters in the body of the susceptible host. So, initially direction is centripetal. After affection of the central nervous system, the virus spreads centrifugally and it affects the various organs, including thyroid gland, adrenal gland, heart, kidney, cornea. So, once the nerves are damaged, there is no chance of recovery. There is no chance of recovery, and ultimately the person will die. So, it is the pathology of rabies. Now, the causative organism, you know that the virus, name of the virus, what is the name of the virus? Lyssavirus type 1. Lyssavirus type 1 shape কিরকম বুলেট শেপেড বা ব্রিক শেপেড, আর এটা হচ্ছে আরএনএ ভাইরাস। তাহলে causative agent is the Lyssavirus type 1. It is a bullet shaped RNA virus. Now, who are the host? All susceptible persons, all warm blooded animals, all are susceptible who are not immune against that virus. Street virus, and what is fixed virus? The virus recovered from a rabid animal, a rabid animal or rabid person. Virus recovered from the rabid animal, that is the street virus. What is fixed virus? When this street virus is attenuated. How? By passing the street virus from brain to brain in the rabbits. It was injected in the rabbits and again it is injected in the rabbit. So, frequent brain to brain transfer of this street virus into the rabbits and ultimately the virus becomes attenuated. Attenuated virus. Attenuated virus means ability to produce antigenicity, but it has lost its pathogenicity. So, attenuated virus means the virus is not able to disease virulence or pathogenicity, but it retains its antigenicity. Why this fixed virus is important? Because fixed virus is important for preparation of the vaccine. Preparation of the vaccine. So, this fixed virus is used for preparation of the vaccines, and incubation period of this fixed virus is roughly 4 to 6 days for laboratory animals. So, for laboratory animals, the incubation period is fixed at 4 to 6 days. But in case of street virus, incubation period varies from 7 days to years. 7 days to years. It may be as short as 4 days. It may be as short as 4 days, 2 years. It may be 1 year, 2 years, 5 years, 10 years. So, there is wide span of incubation period in case of street virus. But in case of fixed virus, the incubation period is only 4 to 6 days and it has lost its pathogenicity or virulence, but it has retained its antigenicity. So, this fixed virus is used for preparation of the vaccines. So, serial brain to brain transfer of this street virus makes it a fixed virus. Clear? Street virus, fixed virus. Fixed virus, short note অনেক সময় পরীক্ষা দেয়। হ্যাঁ, write a short note on fixed virus. এই 3-4টে পয়েন্ট লিখলেই হবে। Now, clinical features of rabies. Rabies in animals. Clinical features কি হবে? একটা হচ্ছে furious rabies, furious rabies and dumb rabies. Furious rabies means the animal is very furious and without any provocation the animal will bite the person whoever comes in contact with it, and there is tendency of running away from home, and the rabid animal bites whoever comes in contact with him or with it. And dumb rabies means the animal remains silent. And there is change in the voice. There is excessive salivation and the animal is not able to take food or drink and ultimately the animal dies. That is dumb rabies. এই ডাম বানানটা দেখে নিও, হ্যাঁ, বি না পি দেখে নিও, হ্যাঁ, পি না বি দেখে নিও, গুগল দেখে নাও, ডাম রেবিস। ক্লিয়ার? তাহলে একটা হচ্ছে ফিউরিয়াস রেবিস, আনাদার ডাম রেবিস। These are the clinical features of rabies among the animals. What are the clinical features of rabies among the human beings? কি বললাম একটা প্রোড্রোমাল স্টেজ that is tingling and numbness for 2 to 3 days. Next is sensory involvement, motor involvement, and ultimately the involvement of the brain. Or the mental state. When the involvement of the sensory system, that means there is aerophobia, hydrophobia. You are sitting in the chair and a suspected rabies patient was brought to you and hand is moving, patient will immediately go under the table because he is afraid of this wind. Clear? And on seeing the water bottle, there will be violent spasm, that is hydrophobia. Hydrophobia is an important symptom, but it is present only in the human being. Animal hydrophobia hoy na. Kintu human being, there is important symptom is the hydrophobia. And after that, there is involvement of the sympathetic system. That means there is excessive salivation, excessive tearing from the eyes. So, when the sympathetic systems are involved, then there is excessive salivation, excessive lacrimation, excessive secretion of the tears. So, these are the features of sympathetic involvement of the sympathetic system. And ultimately, the mental state. Patient is afraid of die, patient is excited, patient is depressed, and ultimately patient will die due to coma or due to respiratory failure. And if we consider about the treatment, there is no treatment. There is no treatment for rabies. Only what we can do, we give only the sedative, morphine. We give sedative so that there is less chance of spasm of the muscles of deglutition or the motor muscles. So, you give the sedative or you can give muscle relaxant and ultimately patient will die. But the person who will treat these rabies patient must take precautionary measures. He will wear gloves, gowns, goggles and also the boots. So, he will take utmost precaution because there is chance, although it is rare, but there is chance of contamination with the secretions or body fluid of that person. That is why the person who will treat the patient will take precautions and also he should be protected with pre-exposure prophylaxis. That means 0, 7 and 28 or 21st day. That means 3 injections against rabies virus. He or she must take this pre-exposure prophylaxis. Next is precaution. Precaution is only vaccination or ki care of the wound. এক নম্বর care of the wound, 2 নম্বর vaccination, 3 নম্বর health education. Before that, classification of the wound. Category 1, feeding the animal, hugging the animal, licking on the intact skin. কুকুর কোলে নিয়ে ঘুরে বেড়াচ্ছ, তোমার গায়ে একটু চেটে দিল, হ্যাঁ, লিকিং অন দ্য ইনট্যাক্ট স্কিন। ক্যাটেগরি 1, নো নিড অফ এনি ট্রিটমেন্ট। ইনট্যাক্ট স্কিন কী করে বুঝবো? একটু যদি এখানে স্পিরিট লাগাও, যদি জ্বালা করে দ্যাট মিনস স্কিন ইজ নট ইনট্যাক্ট। কোথাও একটু মাইল্ড অ্যাব্রেশন আছে, তাহলে অনলি ওয়াশ দ্য এরিয়া। লিকিং অন দ্য ইনট্যাক্ট স্কিন। ইনট্যাক্ট স্কিনে কুকুর বা বিড়াল, হ্যাঁ, যাকে আদর করছি, যদি একটু চেটে দেয় সেই জায়গাটা ভালো করে ধুয়ে নেবে, কিন্তু এক্সট্রা কোনো ভ্যাকসিনেশন নেওয়ার দরকার নেই। ক্যাটাগরি 1 গেল। নেক্সট ক্যাটাগরি 2, নিবলিং। নিবলিং অন আনকভার্ড স্কিন। নিবলিং মানে হালকা একটু কামড়ে দিল, হ্যাঁ, এখানে ওপেন এরিয়া, হ্যাঁ, ফুল স্লিভ নেই, হালকা কামড়ে দিল, ক্যাটাগরি 2। আর কি? স্ক্র্যাচ, স্ক্র্যাচিং, অ্যাব্রেশন, নো উজিং। Mild abrasion or scratching, but there is no oozing of blood. If there is oozing of blood, if it is plus, if it is oozing of blood, that means category 3. If there is history of any oozing of blood following scratching by the animal, then you blindly say that this is category 3. Many times on duty doctors or the nursing personnel fail to classify properly because many times they do not take proper history. So if you do not take proper history, your classification will be wrongly classified as category 2 instead of classifying it as category 3. So if you classify him or her wound as category 2, you will treat him with the help of only vaccination. You will not give immunoglobulin. So in case of category 2, what is the treatment? Only vaccination. No immunoglobulin. আমি তাকে ইমিউনোগ্লোবুলিন দিচ্ছি না, অনলি ভ্যাকসিনেশন। বাট অ্যাকচুয়ালি that person should be administered with immunoglobulin cat 3 তো তাকে ইমিউনোগ্লোবুলিন দেওয়ার কথা, তাহলে প্রপার হিস্ট্রি টেকিং আমি মিস করেছি, দ্যাটস ওয়াই দ্য উন্ড ওয়াজ রংলি ক্লাসিফাইড অ্যান্ড আলটিমেটলি ইউ ডিড নট অ্যাডমিনিস্টার immunoglobulin. Why immunoglobulin is important? Because active immunization with the help of anti-rabies vaccine, it takes about 10 days, 8 to 10 days to develop immunity against that virus, against that antigen of that virus. So This immunoglobulin, if you administer on the first day, it will prevent rabies by neutralizing that antigen for first 8 or 10 days. So, immunoglobulin will protect for 8 to 10 days. That is why it is very, very important to administer immunoglobulin on the first day of reporting. Clear? So, categorization is very, very important. Next is category 3, all transdermal bite. All lacerated wound, single होते पारे, multiple होते पारे. So, all transdermal bite, category 3. All abrasion and bruises where there is history of oozing of blood. All leaks on broken skin. আগে বলেছিলাম কি intact skin. যদি broken skin থাকে 5 days or 10 days old একটা wound, broken skin, if there is leaking, ওখানে কুকুরটা চেটে দিল একটু, হ্যাঁ আদর করছি, category 3. Contact of saliva on the mucous membrane. Contact of saliva on the mucous membrane. কুকুর নিয়ে অনেক আদর করছে, চোখে ওখানে চেটে দিল, তাহলে মিউকাস মেমব্রেনের কন্ট্যাক্টে চলে এলো, ক্যাটাগরি 3. সো all these cases are to be treated with not only vaccines but also with immunoglobulin. So immunoglobulin and cell culture vaccine must be administered as early as possible. Clear? তাহলে ক্যাটাগরি হলো, নেক্সট ইজ ম্যানেজমেন্ট অফ দ্য উন্ড. কেয়ার অফ দ্য উন্ড. ওয়াশ, কতক্ষণ? ওয়াশ দ্য উন্ড থরোলি আন্ডার রানিং ট্যাপ ওয়াটার. আন্ডার রানিং ট্যাপ ওয়াটার. রানিং ট্যাপ ওয়াটার না থাকলে হ্যান্ড পাম্প আছে, কাউকে হ্যান্ড পাম্প, কন্টিনিউয়াস হ্যান্ড পাম্প করতে হবে. কতক্ষণ? অ্যাটলিস্ট ফর 15 মিনিটস. অ্যাটলিস্ট ফর 15 মিনিটস. ইট ইজ ভেরি, ভেরি ইম্পর্টেন্ট. ইফ পেশেন্ট কামস আফটার 1 or 2 days following bite, in spite of that, you advise him or her to wash the wound at least for 15 minutes. Why this is important? Because it has been found that in almost 80% cases, there is washing of the virus from the site of the bite. তাহলে এখানে আমাকে wash the wound at least 15 minutes under running tap water. তাহলে এক নম্বর হচ্ছে wash. 2 নম্বর, next is application of virucidal agent. কি হতে পারে? povidone iodine, even spirit, alcohol. ও আরেকটা পয়েন্ট মিস করেছি, wash the wound with soap water. Why soap? There is outer coating, lipid layer, and the soap will destroy the outer coating of the virus. So wash with soap and water. If soap is not available, রাস্তায় যাচ্ছ কুকুরে কামড়েছে, সোপ কোথায় পাবে? তাহলে in that case you wash properly with running tap water, but it is better to use soap water. Clear? Next হচ্ছে apply povidone iodine or tincture iodine or alcohol or spirit or sablon, whatever is available. These are the virucidal agent. হ্যাঁ, ভাইরোলজি তো পড়ানো হয়ে গেছে, প্যাথো ফার্মা পাস করে এসছে তো. তাহলে you apply the spirit, sablon, alcohol, povidone iodine. So these are the virucidal agent. You apply লোকালি উন্ডে আমি এটা অ্যাপ্লাই করলাম। তাহলে এ হলো, বি হলো, নেক্সট সি। You do not apply stitch or bandage ideally do not give stitches. If stitches are required, you give stitches after 24 or 48 hours later. ফেসে কামড়েছে তাহলে আগলি লুকিং স্কার হবে, তাহলে it is better not to apply stitches immediately, and if stitches are required, you advise the patient that you come after 24 hours, and at the time of applying stitches you infiltrate the wound with immunoglobulin. You infiltrate the wound, in and around the wound you infiltrate immunoglobulin, and after that you give stitches, and stitches will be loose, tight stitch debe na, stitches will be loose, and avoid bandaging as far as possible. If at all required, you give only loose bandage, halka kore loose bhabe debe. Clear? তাহলে wound management is very important. One is washing, another is application of the virucidal agent. Next is question of applying stitches. Avoid giving stitches as far as possible. If at all required, you give stitches after 24 to 48 hours, provided at the time of giving stitches you apply immunoglobulin in and around the wound, and avoid application of bandage as far as possible. If at all necessary, you give loose bandage. Clear? তাহলে these are about the wound, and also you give tetanus toxoid immunization if the person is not immunized against tetanus. Clear? So you give tetanus toxoid. Next is, if there is lacerated wound, you give prophylactic antibiotic, to broad spectrum antibiotic to prevent secondary infection. So these are all about care of the wound. Clear? Next হচ্ছে vaccination. Previously, the person was administered with the nervous tissue vaccine. Another name is BPL vaccine, because this vaccine, the virus was killed with the beta propionolactone. That's why it is also called BPL vaccine. But this BPL vaccine is banned because there is 50% chance of failure. Not only this, there is also chance of I have seen one case. The boy was about 10 or 12 years. One cat or dog, he was inflicted with minor scratch mark by dog or cat, and that boy came to my hospital, and at that time, in the year 1995 or 94, BPL, that is nervous tissue vaccine, which was available at that time, that nervous tissue vaccine was given subcutaneously in the at the site of the umbilicus, probably 5 ml per dose, regularly for 10 doses. After third day, the patient developed various neurological manifestations. And ultimately, patient was referred to NRS, and after 2 or 3 days, the person died. As the vaccine is derived from the nervous tissue, there is presence of myelin, and this presence of myelin may have the side effect of involvement of the various nerves. That is why this vaccine is banned today. Clear? তাহলে nervous tissue vaccine ভুলে যাও. No need of remembering the nervous tissue vaccine. Next, what vaccines nowadays are administered? All are cell culture vaccine. All are cell culture vaccine. One vaccine is purified cell culture mRNA egg based vaccine. mRNA egg based vaccine কোনগুলো? রেবিপুর মার্কেটে পাওয়া যায়, ব্র্যান্ড নেম রেবিপুর. So these are purified cell culture mRNA egg based vaccine. And another is varicocele vaccine. varicocele vaccine কি নামে পাওয়া যায়? অভয় র্যাব বা ভেরো র্যাব. ভেরো র্যাব, অভয় র্যাব নামে পাওয়া যায়. দিজ আর দ্য ভেরোসেল ভ্যাকসিন. ঠিক আছে? আর একটা আছে এইচডিসিভি, হিউম্যান ডিপ্লয়েড সেল ভ্যাকসিন. হিউম্যান ডিপ্লয়েড সেল ভ্যাকসিন. Human diploid cell vaccine, it is almost 100% effective. Human diploid cell vaccine, it is the most important vaccine, and it is supplied in the liquid form. The dose is 1 ml, irrespective of age sex. Dose is 1 ml. What about the Rabipur? Dose is 1 ml. কিন্তু এখানে ডাইলুয়েন্ট লাগে, রেবিপুরে ডাইলুয়েন্ট লাগে. হোয়াট ইজ দ্য ডাইলুয়েন্ট? ডিস্টিল ওয়াটার, পিউরিফাইড ডিস্টিল ওয়াটার. বাট ইন কেস অফ ভেরোর্যাব এখানেও ডাইলুয়েন্ট লাগে, ভেরোর্যাবের ডাইলুয়েন্ট লাগে. এই ডাইলুয়েন্ট হচ্ছে নর্মাল স্যালাইন, purified normal saline. So depending on the type of vaccine, dose varies from 1 ml to 0.5 ml. 1 ml to 0.5 ml. So all these cell cultured vaccines, these are very effective, highly potent. Reaction is almost negligible, and these are highly potent. All these vaccines must give 2.5 internal IU. Next is dose. কি কি শিডিউল আছে বলতে পারবে? এসএন শিডিউলে 0, 3, 7, 14, 28 and 90 days to optional. 90 days optional. 0 means on the first day of administration of the vaccine, not the date of bite. So 0 day means on which day you have administered the first dose of your vaccine. It is SN schedule. SN schedule হচ্ছে জার্মানিতে এসএন বলে একটা জায়গা, সেখানে 1984-এ রিগার্ডিং রেবিস একটা অ্যাসেম্বলি হয়েছিল, যার জন্য এইটার নাম হচ্ছে এসএন শিডিউল. এখানে আইএম শিডিউল ফলো করা হয়. IM schedule for 5 days. So you administer 0.5 ml or 1 ml cell culture vaccine, maybe Rabipur or it may be Verorab, intramuscularly. কোথায় দেব? In the deltoid region, not in the buttock. Gluteal region দেব না. Why? There is presence of excessive fat in the gluteal region. That's why there is delayed uptake of this vaccine. So there is chance of vaccination failure. In case of children, you give in the anterolateral aspect of mid thigh. So for children, anterolateral aspect of mid thigh, and for other personnel, you give in the deltoid region. The site deltoid region, IM, and you strictly adhere to this schedule. 0 day, then 3rd day, count from this 0 date. 0 day, 1st day, 2nd day, 3rd day. Then 7th day, then 14th day, then 28th day. Clear? And 90 days it is optional. This essence schedule is followed, but there is, these vaccines are costly. One dose roughly cost about 300 to 400. So if you give 5 doses, that means 400 into 5, 2000. So it is costlier. That's why at present Government of India follows the intradermal schedule. Intradermal schedule. এটা হচ্ছে থাইল্যান্ডে রেড ক্রস তারা এই শিডিউলটা ফলো করে, কিন্তু এখানে ইন্টারনাল শিডিউলে কি হচ্ছে, আমার 1/5 ডোজ রিকোয়ার্ড। 1/5 ডোজ কতটা দেব? 0.1 ml. On the first day of visit, you administer 0.1 ml intradermal injection in the deltoid region, not only in the left arm but also on the right arm. So শিডিউলটা কি? 0, 3, 7, 14টা দরকার নেই, একটা ভিজিট অমিট হয়ে গেল, কিন্তু 2 সাইডস ইন্টারনাল। ক্লিয়ার? তাহলে 0.1 ml, এদিকে 0.1, এদিকে 0.1, কত হলো? 0.2 ml ইন্টু 4টে ভিজিট, তাহলে 0.8 ml। 0.8 ml ভ্যাকসিন হলে আমার চলে যাচ্ছে। বাট ইন কেস অফ IM কতটা দিচ্ছিলাম? IM এ 0.5 ইন্টু 5, 2.5 ml, 2.5 ml লাগছিল in case of essence schedule, but in case of intradermal schedule dose is only 0.8 ml. Clear? But be sure that vaccine was administered intradermally. Intradermally কিন্তু স্ট্রিক্টলি তোমাকে দিতে হবে। ক্লিয়ার? তাহলে এটা হচ্ছে থাই রেড ক্রস শিডিউল, থাই রেড ক্রস শিডিউল অর ইন্টারনাল শিডিউল, 2 side injection for 4 days, 0, 3, 7, skip 14 dose, after that on 28th day. Clear? So these 2 schedules are usually followed. Now if the person is immunized, if the person is immunocompromised person, like person is suffering from HIV/AIDS, person is taking immunosuppressive drugs, person is taking steroid, person is undergoing treatment for chemotherapy, cancer patient. So these are the immunosuppressed patients. These patients are to be administered with intramuscular schedule. Don't give intradermal schedule. Don't give intradermal schedule. And although the category of the wound, even if it is category 2, for immunocompromised persons, you treat him like that of category 3. That means you not only vaccinate them, but also you vaccinate with the help of immunoglobulin. Clear? Or if there is history of taking anti-malarial drugs, or prophylactically patient is taking chloroquine tablet, in that case there is delayed immune response. So you give them IM schedule. তাহলে এই দুটো তিনটে সিচুয়েশন, history of taking chloroquine, if the person is immunocompromised, in that case you follow intramuscular schedule. And even these cases are these cases belong to Cat 2, you treat these cases as category 3. That means you have to give immunoglobulin. Next comes to immunoglobulin. এই 10টা তো বাজে। ইমিউনোগ্লোবুলিন একটা হিউম্যান আর একটা ইকুইন। হর্স সিরাম ডিরাইভড, যেটা এটা 40 IU per kg body weight, আর হিউম্যান 20 IU per kg body weight. So you give immunoglobulin only one dose, and how to administer? You infiltrate in and around the wound. The multiple wound থাকে, তাহলে you dilute this immunoglobulin with distilled water and you administer. And if the site of the wound is only one, in that case the excess amount of immunoglobulin is to be administered in the deltoid region, away from the site of wound. Clear? বাঁহাতে কামড়েছে, আমি deltoid ডান হাতে দিয়ে দিলাম, rest part. Clear? But not in the gluteal region. So you administer immunoglobulin on the very first day. Depending on the type of immunoglobulin, it may be 40 IU per kg or 20 IU per kg. In case of equine immunoglobulin, there is chance of very rare chance anaphylactic reaction. Even anaphylactic reaction, chance of anaphylactic reaction is there till you have to administer immunoglobulin, because it is a highly fatal disease, almost 100% death if person contacts with the rabies virus. But at the same time, the health personnel must be take precautionary measures to deal with the situation if there is any anaphylactic reaction. Now adrenaline ready রাখতে হবে, oxygen cylinder ready রাখতে হবে. That's why at ID hospital all immunoglobulin are administered after admission of that patient. OPD বেসে থাকে দেওয়া হয় না immunoglobulin. Only IM schedule বা Intradermal schedule যাদের immunoglobulin দেব না তাদেরকে OPD বেসে হয়তো দিয়ে দেওয়া হবে. But those cases who need immunoglobulin are advised to get admitted, and after that they are administered with equine or human immunoglobulin, whichever is available. In case of human immunoglobulin, there is no chance of reaction. Next is health education. Rabies free করতে গেলে কি করতে হবে? Rabies free state করতে গেলে কি হবে? There is no indigenous case of rabies for consecutive 2 years. তাহলে এই স্ট্যাটাসে পৌঁছতে গেলে কি করতে হবে? Eliminate dogs and cats. All street dogs and cats are to be eliminated. It is easier to say but difficult to eliminate. বলা সোজা, হ্যাঁ, মানবাধিকার কমিশনের মানবাধিকার সংগঠনের প্রচুর লোকজন আছে, আপনারা কুকুরটাকে হ্যাঁ মেরে ফেলছেন, কিন্তু if you want to make the country rabies free, you have to eliminate all the street dogs. Next is licensing. Proper licensing must be there. Next is vaccination of dogs. Vaccination of dogs with the cell culture vaccine at 2 months, and second dose is at 3 months, second dose is at after 1 month. That means at the age of 2 months, 1 dose, at the age of 3 months, another dose. Subsequently, the dog is vaccinated yearly. Clear? And also, you take precautionary measures for those persons who are most vulnerable. That means who are veterinary surgeons, who are the dog handlers, who are the hunters. So these high-risk persons are to be given with precautionary measures. That means 3 doses, 0, 7 and 21 or 28. 3 doses of active immunization. That means cell culture vaccines, they will be administered with the 3 doses 0, 7 and 21. If a person has taken full dose of vaccines, again the person was bitten by an animal. So if there is history of complete immunization within a span of 6 months to maximum 1 year, because the antibody remains years, it may be 1 year to 3 years. So if there is history of second time exposure within 6 months, only 2 doses, 0 and 3, only 2 doses will suffice, and there is no need of giving immunoglobulin. The previous history of immunization thagle, no need of giving any immunoglobulin, only 2 doses are required, 0 day and 3rd day. If the person gives proper history, proper documentation. But if it is within 6 months, you give afresh. Clear? And health education, avoid the rabid animals, and you take precautionary measures. You try to vaccinate all the animals, particularly dogs and cats. Clear? So it is very difficult to make our country rabies free.